All right. Hello, everyone. Welcome to today's presentation in our Coping Through COVID webinar series. Today, we're going to be talking about mental health or 101. And so we're going to be talking about her mental health, mental illness, signs that you might need help, and more. So my name is Julie Rubel, and I am a graduate assistant here at Student Wellness, and we are a part of the counseling and consultation services here at NIU. And alongside me to help me today, I have Myra, who's a part of our wellness crew, who assists us in health promotion. And so, just briefly, I want to touch on the dimensions of wellness. And so, a lot of the times, or when we think about wellness, you might think about I have to eat healthy, I have to work out, etc. But wellness is a lot more than that. As you can see on the wheel, there are a lot of different aspects of wellness that we need to take care of in order to be well. And today's topic is going to primarily focus on social and emotional wellness, except when you are talking about mental health, all of these can be impacted. And so just keep that in mind. And so to move forward, I just want to briefly do a sensitive topic warning. And so we'll be discussing content in this presentation that might be uncomfortable for some participants. And so if you find yourself feeling uncomfortable or distressed, please feel free to leave the presentation and take care of yourself. And of course, you can always reach out to us as well if you feel you need to be connected to a crisis hotline or something of that sort. All right. So just some things that you are going to be learning today. We're going to talk about myths and facts about mental illness. You're going to learn about mental health and mental illness, signs and symptoms that might mean you need some extra support, and an overview on what seeking help might look like on campus. So now we're going to talk about the myths and facts of mental illness, and this is where I would like everyone to connect to our Kahoot. I'm going to stop sharing my screen really quick and pull up the Kahoot for us to all do this together, and so that'd be really awesome if we could all participate. I'm just going to switch screens. All right, and so if you want to go to kahoot.it and then type in the code on the screen. That would be awesome. I'll go ahead and type the number in the chat too if anyone's having issue reading it. All right, and so we can go ahead and get started on the Kahoot. Just give me one moment. All right, so I'm going to go ahead and click start then. Is everyone in? Do we need another minute if someone just wants to give me like an update?
I need one more minute. I'm sorry, I'm having internet problems.
No, that's okay. No worries. I'll give it another minute or so. Just give me a thumbs up as soon as you're ready.
I'm sorry.
Do you need another minute or so?
I think you might have to play out without me. I'm sorry, it's not
No,
working.
that's okay. No worries. Thanks for letting me know. Okay, so I'm just going to go ahead and get started then. Here we go. And so these are all going to be true or false. And Myra's going to be helping me with this as well.
Yep, so let's get started. Having a mental illness makes you crazy.
All right, so it's looking like everyone chose a false, and that is the correct answer. And so you are correct. It does not mean you are crazy. It means that you are vulnerable and human. It means that you have an illness and it might have challenging symptoms. And so this illness, it might alter how your moods, how you respond to stressors, or even skew your perception of reality. And having symptoms to an illness does not make you crazy. All right, who's winning? All right, Taylor's winning.
Okay, so next one. People with mental illnesses are violent and dangerous.
All right, everyone is correct. And so this is also a false. And this is false because only 5% of violent crimes in the United States are committed by people with a serious form of mental illness. And so the truth is that people with mental illness are more than likely to be victims of crimes due to their vulnerability. Woohoo, we're on a roll.
Okay, so psychiatric medications are bad.
Awesome. So everyone is correct. Just again, you guys are killing it. And so this is false, or because psychiatric medicine is not meant to be harmful or an easy way of coping with their mental illness. And so for many mental illnesses, taking medicine is necessary, just like a diabetic taking their insulin. And it may be taken to help reduce their symptoms. And so taking medicine as well is a personal decision or between one and their doctor. Spencer's on the come up.
Okay, post-traumatic stress disorder or PTSD only happens to people who go to war.
All right, so wow, everyone's doing so great. This is awesome. And so yeah, so this is false because anyone can develop a PTSD. It can occur after experiencing something traumatic firsthand or witnessing something traumatic happen to someone else.
Asking for help makes you weak.
Five more seconds. All right, and so this is false because asking for help can be an extremely difficult thing, and it actually makes you strong and courageous to have the ability to be vulnerable to another person. We have one more.
Okay, last one. Mental illness is common.
All right, so this one is true. And this is true because nearly 1 in 5 U.S. adults experience some form of mental illness. So just some other stats on this. 1 in 24 has a serious mental illness that can result in serious functional impairment. And so what that means is that their illness, it causes them to not be able to do normal daily tasks for themselves. And so this might be going to work, cooking food, taking a shower. And so all of those things can fall in that umbrella. And then 1 in 12 has a diagnosable or substance use disorder. All right, just gonna talk about the winners. I'm gonna stop sharing though because everyone's a winner in my eyes. Stop sharing. All right, now I'm gonna go back to my PowerPoint. Just give me one moment. All right, and so we were just on the myths and facts of mental illness, and now Myra is going to be taking over the next part of the presentation.
All right, everyone. So, what is mental illness? Well, mental illness is a health condition involving changes in emotion, thinking, or behavior, or a combination of these. It can also be associated with distress or problems in functioning in social work or family activities, and it impacts your overall ability to function in everyday life. It can also occur at any age, but 3/4 of all mental illnesses occur by the age of 24. Which leads us to what is mental health. Mental health is more than the absence of mental disorders. It is a state of well being where one recognizes their abilities, can cope with normal stressors of life, can work productively, and is able to make contributions to one's community. Which leads us to why is mental health important? Mental health is important because it can impact all other areas of our wellness. Working to improve one's mental health may help you coping with everyday life stressors, be physically healthy, have good relationships, making meaningful contributions to your community, work productively, have stability, and realize your full potential. Now let's talk about mental health and COVID-19. The COVID-19 pandemic has impacted the wellness of an individual on almost every level. It has impacted one's emotional, physical, social, and financial wellness. Your expectations of your college experience may have been lost throughout the situation. As a college student, you may already be stressed juggling the different aspects of your life. You may be trying to balance your studies, your job, organizations, meeting people, and making memories. And on top of that, it's the expectation that you take care of yourself. Now, if you throw in the pandemic, the stress of these things may be increased due to the loss or the difficulty of trying to maintain them. No one knew the pandemic would occur, and no one prepared you on how to deal with it. And it is okay to not be okay. Increased feelings of anxiety, depression, and stress during the COVID-19 pandemic are common. Active Minds, which is an organization that raises awareness for mental health, completed a study that found other students' mental health has been impacted. For instance, 1 in 5 college students say their mental health has significantly worsened. 80% of the college students reported that COVID-19 has negatively impacted their mental health. The most common ways of COVID-19 has impacted college students has been through stress and anxiety, 91%, disappointment and sadness, 81%, loneliness and isolation, 80%, financial setback, 48%, and relocation, 56%. So, mental health and self-care. First, let's talk about some signs and symptoms that may mean your mental health is struggling. They can be seen in a number of different ways in your body. They can be physical signs, which changes in how your body feels and functions. You can experience headaches, low energy, sleep changes, either difficulty sleeping or staying asleep, stomach problems, muscle tension, weight loss, or weight changes. There can also be behavioral signs, which can be like procrastination, ability to complete tasks, sleeping too much or too little, eating too much or too little, excess smoking or overuse of alcohol or other drugs, Cannabis is one of them too. Relationship troubles like feeling distance from others. And you can also experience emotional signs such as being more irritable or prone to anger, difficulties managing mental health like anxiety and depression, feeling down, unhappy, crying easily, feeling burnt out and overwhelmed. And you can also experience cognitive signs such as trouble thinking clearly, difficulty concentrating, forgetfulness, lack of creativity, humor, um, expecting too much from others, inability to make decisions, constant worry, and being self critical and pessimistic. So now we'll move on to Julie, who will talk about how to take care of your mental health with these things.
Yeah, thanks, Myra. And I also just want to highlight that we did just throw in a bunch of information on different types of signs in your body that you might experience if you are needing some extra type of self-care. And I just want to acknowledge that it is a lot and you might experience some of them, a number of them, or all of them. It really depends on the person. And so if you are experiencing something that's not on the list, it's also okay. And that could be true to you. All right, so moving forward, I'm going to talk about how to take care of your mental health. And so first, I'm going to talk about some tips and tricks to do to help you with your self-care. And then as we move forward, I will talk about when the self-care is not enough and when you might need that extra type of support. All right, and so the first one I'm going to be talking about is to take care of your body. And so by this, we're talking about eating better, sleeping well, and moving more. And so just to touch base on some of these things. To eat better, college, it's an extremely difficult time, and you might be tempted by all the junk food in the dining halls, and it's easy to walk straight to the pizza and the fries and everything like that. And that's all right if you want to eat that, but try to eat balanced meals with fruits and vegetables and drink plenty of water. Stay hydrated. If you are dehydrated, it might kind of appear as hunger. And so try to drink a big glass of water or before moving forward with food. Have your healthy snacks accessible in your bag. I do recognize a lot of classes are online, and so maybe keep it next to your computer because then you can snack on that instead of going to your pantry and grabbing some chips. And avoid excessive use of alcohol and other drugs. And we include this because if you do choose to drink in moderation, that is up to you. But at the end of the day, alcohol and other drugs are usually depressants. And so what that means is that in the moment, it might help you feel a little less stressed. It might make you feel a little more happier, but it is a depressant. And so as soon as you become sober again, it will possibly make you feel worse. The next is to sleep well, and so aim for 7 to 9 hours of consistent sleep per night. In college, it might be kind of the thing to have only a few hours of sleep and pull all-nighters, but sleep is super important for our well-being overall, and so try for the 7 to 9 and try and limit your naps for 15 to 20 minutes. That might sound unreasonable because you might be thinking, who takes 15 to 20 minute naps? But those shorter naps can actually help you feel refreshed and give you more energy. And establish a nighttime routine, because if you do create a routine, eventually your body and your mind are going to realize like, hey, it's 7 o'clock. It's about time to start winding down. So let's go brush our teeth and let's do our bedtime routine, and that can help you sleep better. And lastly, move more. And so being active can help you focus, learn better, and sleep better. And so that means getting that type of energy out in your own way. So that brings us to the second one. Move more in your own way. I hate running, so I don't run. I like to walk on an incline, and that's okay. If you enjoy jogging, hiking, biking, find what works for you. Next, find some connection. So especially during this time of COVID, a lot of people were stuck in their homes around their family or with their roommates, and it might have been kind of isolating. And so to find that type of connection, it's more than just physically being in a room with someone. It could be actually having conversations, enjoying quality time together. And so that kind of brings us to the social connection. Talk to others. And so this can be in person or virtually through texting, FaceTiming, etc. Schedule time to be social. And so I know for myself, I'm a very busy person. I'm in graduate school. And so what that means is that I might have to schedule a dinner a few weeks in advance to see my friends, but I still schedule that time to be social, and I put it in my calendar, and I'm like, okay, I'm going to turn off my brain during this time, and I'm going to spend time with the people who recharge me and make me feel better. And lastly, get creative virtually. And so this could be through the House Party app or another app where you can spend time with others. Or this could even mean engaging in Discord or Reddit threads. And so connecting with others in that way. And the next is to connect with yourself. So meditate, journal, creative expression, and identify goals and values. All right, moving on to helpful skills. Do more things that make you feel good. And so spend a lot more time doing things that make you feel positive, happier, etc. Develop a habit and routines, create and hold boundaries. And so what this means is possibly saying no more and saying yes to yourself. And so putting yourself above everyone else. Celebrate your accomplishments instead of your downfalls, and seek extra support. And so this could be by talking to clergy, friends, family, and other people who you're able to confide in. All right, and so now we're going to talk about some signs and symptoms you might need extra support. And I do recognize it's 4:25, and so we will more than likely go over in time. I just want everyone to be aware of that, but I'm happy to continue on going. All right, and so these are some signs that might mean you need to seek mental health treatment and that extra type of support. And yeah, Marissa just said that boundaries have helped her so much, and I completely agree. Boundaries are life-changing. So the first is if you are feeling overwhelmed. And so if you're feeling overwhelmed, you might feel like you have too many things to do or too many issues to cope with. You might feel like you can't rest or even breathe. Stress and feeling overwhelmed can lead to serious mental health concerns. The next is you are more tired and feel like you have no energy. And so this is a physical symptom that often results or accompanies mental health issues. And it can indicate you're possibly experiencing depression. Fatigue can cause you to sleep more than usual or have trouble getting out of bed in the morning. The next is you are feeling angry and irritable. And so what I like to call this is lashing out. And for myself, I recognize that when I'm feeling overwhelmed, I lash out at people. I feel very irritable. It's like, when you are walking out of a room and your belt loop, it gets stuck on a door handle? That's kind of what I'm talking about. It ruins my entire day. And so everyone feels angry at times. And even passing rage isn't necessarily harmful. And seeking support to deal with these feelings might be a good idea when they don't pass, are extreme compared to the situation, or if they lead you to take violent or potentially harmful actions. The next is you have anxious or intrusive thoughts. And it's normal to worry about things from time to time, but when worry takes up a significant part of your day or even causes physical symptoms, therapy can help you deal with it. The next is you are apathetic, and so you're losing interest in usual activities, how the world around you, or life in general can indicate mental health issues like depression or anxiety. You might have feelings of hopelessness, and so losing hope or motivation or feeling as if you have no future can indicate a depression or another mental health condition. And feeling hopeless from time to time, especially after a period of difficulty, isn't uncommon, but when it persists, it can lead to thoughts of suicide, and that's when it becomes scary. And lastly, you are isolating to yourself. And so many people feel better when they're able to spend at least some time alone. And introverted people might need even more time alone compared to others. But if you feel distressed around others or fear being with other people, therapy can help you understand and deal with these feelings. All right, and I just want to note, you can seek mental health treatment for other reasons that are not listed. And overall, just speaking to an unbiased person about your everyday stressors has benefits on its own. So now we're going to move forward to how to seek help. And we're talking about on-campus resources. And so before I do that, I want to touch base on the type of services and what it looks like, especially now in the time of COVID. So prior to COVID, in-person services were kind of the go-to. And so what this looks like is in-person, face-to-face services. And so this is you are meeting with your clinician one-on-one in person to move forward with your services. And due to the pandemic, you and your clinician now might have to both wear masks to prevent the spread of COVID-19. The next is telehealth services. And so this has become increasingly popular because of COVID-19. And so what this is you will meet with your clinician virtually to engage in services. And so you'll meet on a confidential platform where you're in one location, so possibly your car or your bedroom, etc., and they are probably in the office or in their home. And masks might not be required due to the likelihood of you being in a private location alone because of confidentiality. All right, so now we're going to talk about on-campus resources. Sorry, just had to take a drink of water. So the first thing I want to talk about is counseling and consultation services. And so this is located in the Campus Life Building Room 200. And so what they do is they provide individual and group therapy, psychiatric services, and can provide you to referrals to other service providers that you might benefit from. And so what they primarily practice is brief therapy. And so this is usually a total of 10 to 12 sessions. I'm not sure specifically how many, but it's intended for short time. And they are able to provide you with outside resources to other agencies for longer term services. And then the service is free completely to students. And so that's super awesome because you as a student have access to these free services. The next one is the Community Counseling Training Center, and they are located in Graham Hall, room 416. And they provide individual, couples, and family therapy. And sometimes they do have the ability to provide group therapy, depending on interest and need. Right now, because of COVID, I believe it's not happening, but possibly post-COVID, it could be a thing again. And these services are also free to students. The next is the Couple and Therapy Clinic on campus. And they're located in Wirtz Hall, room 146. And they provide individual, couple, and family therapy. And this payment is based on income and is sliding scale. So sliding scale is when they take your income and put it on a scale and decide how much you're going to owe. All right, so now we're going to talk about, where is it? Sorry. All right, so I'm going to talk about this first. It's kind of out of order, so I apologize. And so what you might hear in your intake appointment. The first is a psychiatrist. A psychiatrist is a medical doctor with special training in diagnosis and treatment of mental and emotional illnesses. This person is qualified to prescribe medication. A person who is a therapist and does not have a medical degree is not able to prescribe, and so they may refer you to a psychiatrist. And so as previously discussed, for some, medication is necessary in treating their mental illness for improved mental health. The next is confidentiality, or privacy is an easier way of saying it. And so what this means is that the clinician who you're working with is not going to leave revealing information on voicemail, text, or email unless you give permission to do so. And it means not acknowledging to outside parties that you have an appointment or are seeking services. And so the example I have is if someone calls to the office and says, hey, does so-and-so have an appointment today? They cannot confirm or deny unless there is a release of information, in which I will talk about in just a moment. It also means not discussing the contents of therapy with a third party or without permission. And there are limits to confidentiality. And what that means is there are times where confidentiality can be broken. And this is if the clinician is afraid how you're going to hurt yourself. And so if there's a safety concern, if they have a concern that you're going to hurt someone else, or in cases of you hurting another person in terms of child abuse or neglect. The next is a release of information. And I've already mentioned, but it's a legal document, and it gives the clinician permission to discuss different parts of your treatment to another person. And so this is usually a physical form that you sign and you put a date on it. And so you can decipher who, what, when, where, and for how long you give a permission for them to contact them. And you are able to withdraw consent of the release of information at any time. The next is collaboration on services. And so basically what this means is different professionals who work together to best help you in your treatment. And so it might be a therapist and a psychiatrist who are working together, or a therapist and a nurse or primary care physician. And lastly, a mandated reporter. All clinicians are mandated reporters, and this is someone who's required by law to report a suspicion of child abuse and neglect, abuse or neglect to a person in a vulnerable population. So this could be the elderly or a person with a disability, and harm to others. All right, so now we're going to talk about, we're missing 2 slides. Awesome, love that. And so the intake appointment overview, we're going to talk about this. And so what this is the intake is the first appointment you will have with a clinician. And in this appointment, the clinician is going to ask you in detail about why you're seeing them, and so otherwise known as your presenting problems, family history of mental illnesses or other sorts. They are going to discuss signs and symptoms, how you're experiencing, and they might complete an assessment or a test if necessary. And so this is a place where you might discuss and develop treatment goals. And so those are things that you will do in your session, and it's something to focus on and work toward. And so a treatment goal, it might kind of look like decrease symptoms of anxiety by practicing and developing coping skills. That's just one example. You might even get a referral to a psychiatrist. And so as I've talked about, for some mental illnesses, medication is extremely beneficial, and it is a personal choice, but how they might refer you to one. It is a place to learn about policies and procedures of the service provider. And it's a place to ask questions. This person's going to get to know you, and they might even get to know you in ways that most people don't. And so it's okay to go ahead and ask your clinician stuff about their treatment approaches or their thoughts on what's going on with you. It's a place for you to be honest with them about what's going on with you. And at the end of the day, I'm going to move forward, and you might not connect with your clinician on the first try. And finding services that are right for you might take time. And the first person who you might see, as I said, might not be the right fit for you, and that is okay. And it's okay to find someone new to work with. I like to compare it to dating around. You might go ahead and meet different people until you find one who fits right. And even then, there might come a time where it no longer is feeling right and you might feel stuck. And so you can go ahead and choose to move forward. All in all, sometimes when self-care isn't enough, it might be some time for some extra type of support. It's okay to not be okay, and seeking mental health treatment can help alleviate some of the heaviness. And then here are some resources that we did discuss, but I'm just going to put them on here. I will go ahead and add Safe Passage is a domestic violence shelter and rape crisis center. They do provide free services as well and legal advocacy to those who are survivors of domestic violence and sexual assault. Ben Gordon Center is an agency. And then I have some phone numbers there listed that are anonymous and they can assist you in times of crisis or even just if you need someone to talk to. So there's a National Suicide Prevention Lifeline, a crisis text line if you are kind of nervous about talking to someone, and the Trevor Project, and you are able to call or text them. And of course, I just want to throw this in here to join us for more the webinar series that are in the future. The next one is in 2 weeks, and it is on developing healthy relationships. And then the last two are stress versus anxiety, sadness versus depression. And so those are kind of to help you decipher between those two. If you can go ahead and take our survey, that would be super awesome. And I'm going to go ahead and put the link in the chat if you do have a moment to take that for us. And I'm going to continue on being in here. If anyone has any questions, I am in the clinical mental health counseling program here at NIU. And if you have any specific questions about anything, I would be happy to help or direct you to someone who can help you.